In the niche medical field of oncology, physicians are charged with the task of eliminating a staunch opponent, cancer. And in community oncology practices around the country, it's the only thing doctors and their staff are focused on. Yet despite their passion for improving cancer patients' lives, community oncology centers are being squeezed out and absorbed by hospitals. These vital neighborhood practices are closing their doors at an alarming rate because they simply can't afford to stay in business. Which raises the question, why are the cancer eliminators being eliminated themselves?
In 2004, the government changed the way that they reimburse oncology practices. Many commercial payers adopted these, and it really put a financial squeeze, quite frankly, on the practices, such that many have closed. Hundreds of community oncology practices have gone out of business. Some left those rural communities, and there's no access to care there. Many joined health systems, hospitals. Hospitals have different payment methodologies that they often have an advantage over community oncology. The unintended consequence is that these low-cost providers, the community oncology practices, were forced into a different setting where actually the cost is higher. It costs more to deliver oncology care in a hospital system than it does in the community.
But unlike hospitals, community oncology centers are based on quality, not quantity. It's not about how many patients they treat, it's about how well each patient is treated. The standard of care is higher and costs are lower. This is accomplished through more streamlined practices. Cancer patients are the only patients they see, so oncology centers are equipped to deal with their specific needs. Better triage, no test duplications, fewer ER visits.
In a community oncology center, where the doctor has a one-on-one relationship with the patient, they have a better handle on exactly what the needs are and exactly what services have already been rendered, from treatment to diagnostic modalities. So they can use, in an efficient manner, only those things that the patients need, and hopefully reduce some of the costs of care of these patients. In addition, community oncologists many times are located in the communities of the patients, which limits the patient's problems with travel and getting back and forth to their physicians and services.
Quality and care is very important to us, that they actually are up on the latest things that are going on, that their patients actually have access to clinical trial when they've gone through the first 2 or 3 phases of therapy, and we're looking for what is the next drug, what's the next treatment. They have an outstanding drug development unit associated with them that allows my patients to go to that and get really world-class care that they can get as well as any place else in the United States or world for that matter. Patients that go through the cancer journey is very difficult. It's not a very easy thing to go through. And as you go through that journey, you want to be sure that the people that are treating you are compassionate about what they do and engaged about your care. And so I think that that's another thing they really provide well here.
At a time when cancer rates are soaring, the need for quality care is obvious, and community oncologists are advocating for healthcare changes in the name of survival.
We have to bring some of the latest technology, not only from treatment of cancer, blood disorders, but also compassion in regards to getting them the medicines they need, the financial support they need, the psychological, nutritional support that they need. So it's a focused effort that requires a larger encompassing milieu to accomplish our tasks.
Since 1976, Tennessee Oncology has provided quality cancer care. Cutting-edge technologies and treatments, coupled with a passion for improving patient outcomes, makes the physicians here leaders in oncology services throughout the Middle and East Tennessee region. Every patient is carefully evaluated, and a treatment plan is customized to meet an individual's needs. The team here believes in working together, drawing on the strengths and talents of the highly qualified doctors on staff. Together they make a community of oncologists who are qualified and ready to tackle this community's cancer needs.
You know, when you first get diagnosed with something so traumatic, you don't know how you're going to get through it. And to know that you have someone on your side, someone that's going to do anything they can for you to help make you better. They made it a little less scary, a little less uncomfortable, Coming up here so often, going through your treatments, you just kind of feel like they become family almost. You know, when you're here months and months at a time, they become almost like family. I would not change my journey for anything in the world, and I'm just thankful that the doctors at Tennessee Oncology went through that journey with me, because they were a huge part of my journey through breast cancer.
With over 30 locations throughout Middle and East Tennessee and Northwest Georgia, most patients can find a conveniently located treatment center, keeping you close to home and your loved ones.
We have access to radiation treatments, infused chemotherapy, which is our main line business. Many of our therapies are now going to oral, so we have our own pharmacy with oncology-specific pharmacists. We have imaging, and those are the main treatment modalities or diagnostic modalities that touch the patient, so we try to have them have access to all of that in one spot.
What I can tell people about Tennessee Oncology is that it's looking ahead. It's looking to the future of what may be the best care for the patients, but also how to deliver it. It's done a great job trying to foresee things and then adapt, not for Tennessee Oncology by itself, but what for the patients need. And as a result, I believe the patients have benefited greatly.
Tennessee Oncology, where the only goal is to improve life, one cancer patient at a time. To learn more, visit us online.